Welcome back to Elevator Paso, guys. Thank you so much for staying with us. Elevator Paso is a program dedicated for raising quality of life. We do this through inspiration and education. And for this today, we're at Mind Forward. We're going to be speaking with Dr. Viridiana Ortiz and Dr. Roberto Flores. They're going to be telling us a little bit about the world of psychiatry and psychology. How are you guys?
Pretty good. Thank you for having us.
Thank you so much for being here. I want to start out by learning a little bit about what it is in regards to psychiatry, the medicine, and it's so often you hear about a negative connotation towards depression medicine and that kind of deal. Can we talk about this?
Yes, of course. Well, psychiatric medications are widely used across the world, not just here in the United States. And contrary to, the public's perception, they're fairly benign when used appropriately. There is a class of medicine that can be a little bit difficult, that might create a dependence. But again, if you are under professional supervision and guidance, they can help a wide variety of problems. And, our patients tend to recover from many psychiatric ailments. Of course, they have limitations, as with any medicine, for any medical problem, of course, but that's why we also try to incorporate the use of talk therapy, like with my colleague and partner, Dr. Ortiz, and the work that she does here at our clinic.
So, Dr. Ortiz, what is that process like? What point do you feel that it needs to move forward and go beyond talking?
Mm-hmm. So we conduct an initial assessment, of course, right? And upon evaluation and processing things, I'm a trauma therapist. That's my specialty, right? So when we see that patients are stagnant and they're not making any progress, that's when we consult with Dr. Flores and we refer them back to him because he's a specialist, right? So we want to have this collaborative effort to make sure that, yes, through psychotherapy, absolutely, but we may need a little bit more of an assistance here, right? And that's why we created this clinic, to have both psychiatry and psychotherapy.
Yeah, so it's a one-stop shop for all your mental health. That's excellent. So at what age do you start seeing patients?
12 years and older.
12 years and older. And for the meds, is there any limitation to age?
Well, no, not really, but I still try to do the same, 10, 12 years of age and older. Sometimes I feel that a younger brain that is younger than 10 years of age is still maturing, sometimes a little more sensitive to medication. So we just have to be a little more careful with that. And that's why we decided on that age group.
When I was a kid, just a very long time ago, I was told I had ADHD. But back then it was a myth. That was not real. I was just a hyperactive, bad kid, troublemaker. Well, come to find out a year ago when I look back and see how the trend in life and discipline and so on, it's a very real thing. And it's a very real thing in my life. And so I started some medication, and I noticed that it's a vast difference between even the brands. And I've noticed that some make me hyper productive and some actually just make me more scatterbrained. What is there, how do you balance this out? How do you do, I've tried doing this natural stuff. Where do I find a balance here?
Well, like you said, sometimes it's a little bit of a trial and error, right? Unfortunately, in psychiatry, different than other medical specialties, we don't have a lot of labs or things that we can rely upon to really target our treatment, but we tend to do it through a comprehensive psychiatric evaluation based on your history, based on present symptoms, and also tolerability. If you feel like one medicine has given you problems and we mark it as a negative effect perhaps, and then we try to look into another direction. There are some new techniques and tools that are out there that are studying, for instance, liver metabolism in each individual.
Oh, wow.
And that might gives us an idea of what medication might be more appropriate to each, patient.
So let's dwell on that. Why?
Well, it has to do with how fast you get rid of the medication or not. So it stays longer in your body, meaning that your brain will take advantage of the substrate, better.
I see.
Yeah.
And in regards to, you're at a point, I'm 42 years old. So me coming to this realization was at 41. This diagnosis happened when I was not even a preteen. You know, and often I feel that it's been a bit of a buildup. You know, it's like, well, you know, all these things I thought were, I have a checklist of all this that I need to work on myself. It's like, no, that's your brain. That's who you are now. And I feel like it's all been built up, and there's like, well, where do I go from here? Is it too late at 42? Medicine could help at some point, but I feels like it's not enough, or like something else needs to give here.
Well, it's never too late. It's never too late to try, you know, medications or anything like that. But so a lot of these symptoms, like I said, can be very well addressed through psychotherapeutic techniques. You know, things that you can learn in therapy to deal with daily stressors, organize your thoughts a little better, that you don't necessarily need a medication for.
Dr. Ortiz.
So a lot of behavioral modification, right? With ADHD, we gotta target that. What behaviors we gotta adapt, your cognitive distortions, what healthy coping skills we're gonna be using. So definitely, it's never too late, right? But we can definitely tackle and work on that in therapy.
So do you get this often? Do you get patients that feel that it's too late?
We do. We have a wide variety, right, of patients, and I think sometimes we think that it's too late because I'm 40, because I'm 30, but it's never too late, right? The good thing is that you're actively seeking and pursuing a better mental health.
There you go. So, mind forward, and it looks like you're gonna find me here now. Before I let you guys go, is there anything we should know about your services, about the clinic itself?
We wanted to open this clinic so we could have like a one-stop shop, right? We have wonderful providers here like Dr. Flores and the other providers here as well, providing quality mental health services to the border region of Los Angeles.
I would like to add that we're fully bilingual, so if you are requiring services in Spanish, we provide that also, and we have the capability of also doing telemedicine from the comfort of your home.
And where do they find information?
We have our website, and which is mindforward. We're revamping that, but if not, we have a phone number, 915-832-1702.
Thank you so much for the
Thank you.
Stick around, guys.